250,000 women a year are diagnosed with breast cancer in the United States. Getting a diagnosis can become overwhelming. Women report it's felt like they were hit by a 2x4. They report feelings of shock, fear, anxiety, and confusion. Anjali and I are here to share with you some innovative technology that we think will transform the cancer journey. As a clinician, it's important to me to provide good education and information to my patients to make well-informed decisions about surgical options. I do tell my patients to not go and search or Google the word breast cancer, because when they do, they get overwhelmed by the information, and it's hard to navigate through that. In this Harvard Business Review, they'd actually discussed how when fear and anxiety play into the equation when a patient's diagnosed with cancer, they have a hard time making good decisions. And actually, technology and the mobile devices that we have today can alleviate the anxiety and result in a better experience. Patients actually spend less than 1% of their time with their doctor or in the clinic or hospital. 99% of their time is spent in self-management or in the home or workplace. For 150 years, Mayo Clinic has provided trusted health information to our patients. As chief medical editor for our mayoclinic.org website, we value giving expert and excellent information to our patients through our digital content, but we also are moving to advanced technology using voice-activated content, and now to microlearning videos. For years, we've been handing out pamphlets and brochures to our patients to help them understand the different surgical options. We even went to a computerized desktop model to help our patients understand their options in breast cancer surgery. And they would tell me when I would sketch, "Can I have your drawings, because I need something to go home with?" In 2014, we were awarded a Center for Innovation grant to build a web-based tool to deliver this information on an iPad that they were loaned to go home with to have access to Mayo knowledge at their fingertips. But now, fast forward to 2018, why not give them their information on a platform where they can have access to microlearning videos at a time when they need it, on any device, anywhere, anytime in the world, even before they become a patient at the Mayo Clinic. So now we're in the new digital experience, and we call this the Netflix of the healthcare experience for our patients. We think not only our patients at Mayo, but all patients can benefit from this technology. And we have shown excellent results from our early pilot that Anjali will share with you. But now when you think about what I started with, I don't want my patients going to the web and searching the word breast cancer. Why can't I give that information to them in a controlled, curated environment where there's no advertising, they're hearing from the Mayo physicians about their options using these videos. We're engaging them, and we're helping them get information at their fingertips. And Anjali is going to share with you now the new patient-activated technology.
Thanks, Sandhya. Hi, everyone. I'm Anjali Kataria. I'm the CEO and co-founder of Mytonomy. And with the world's information at our fingertips, it's no surprise that patients are going online. 80% of patients are looking up healthcare information. And the way we learn has fundamentally changed. If I was to ask you, if you sprained your ankle, what would be the first thing you would do? Probably go online, look up a video or read something, and then figure out what to do. Because the way we learn has changed. Whether it's making a banana bread or whether it's healthcare, we're going online and looking up information from anywhere in the world. What we're doing at Mayo together is harnessing the power of this consumer trend with the stickiness of the engagement that comes along with it, and delivering and filling the void that patients have of wanting to go online and look up information. And we're seeing very high engagement levels. At Mayo, at the breast cancer clinic, we're seeing that those patients that were given an email to go and watch 17 videos, short 1 minute to 3 minutes in length, we call microlearning, 88% of them went online and watched. We're finding that of those that watched, more than 50% were highly engaged, meaning they were watching more than 50% of the total content available to them in this curated private site. And this is great because activated patients yield better outcomes and improve patient experience and ultimately better utilization. These patients were also very happy because the clinic had given them exactly what they were looking for when they most needed it and when they were ready to absorb that information. This site gave me the ability to have a great overall experience with Mayo Clinic. And the catch is, they weren't even here yet. Let's take a look at what the microlearning looks like.
Finding a breast lump or having an abnormal screening mammogram can be very stressful. If this happens, you will need to have more imaging or pictures of the breast. Examples of these imaging tests are a diagnostic mammogram or an ultrasound.
And the journey continues. The next wave for us is to personalize and tailor the content and include more cultural relevance, because we know that if we can reach patients where they are by tailoring content that's relevant for them, we can drive even higher levels of activation. We also are trying to uncover the hidden. Using AI and looking at scale, we can uncover the hidden patient behaviors that that enable us not to be able to take care of ourselves, and yet we can't even see what these characteristics are when they're in front of us. This journey is just at the early stages, and it's one that we're very excited about.
So it is truly transforming the cancer patient journey. We want to give trusted health information to our patients when they need it, when it's in their own home, at a time when they can absorb that information. And more importantly, we are engaging our patients.
And as a tech entrepreneur, it's actually much more than just the technology. It's about applying the technology to enable and extend the human experience, creating a high-tech, high-touch experience. We've been talking about the pyramid here at Mayo. It's about flipping that pyramid, being able to reach millions of patients in ways we've never been able to reach them before.
Thank you. I love what you said about we learn differently where we're going online. We sprain the ankle, and before we do anything, we go online. So how in 5 years do you think, when I roll down the stairs, how will that even be different from what I do today? Just spitball. Just think about how that experience will be when I hurt myself in 5 years. What will happen?
I think more and more care is going to be moving to our home. We're going to have voice, and we're going to have video, and we're going to be empowered as consumers, as we have in other areas. We no longer really go to the bank and stand in line to deposit our paycheck weekly. We do all our banking online on our phone. We don't go to the library anymore and look up and things in card catalogs, right? So I think healthcare is just in that wave. And with sensor technology, we're going to see more diagnostics available, more home labs available. And very rapidly, we're going to see that patients taking charge of their own destinies in healthcare, becoming more activated and able to do things that typically they had to go into the clinic for.
So right now, it's easy. You cut yourself, you put a Band-Aid on. That's healthcare I do myself in my home. But now we're going to be spraining our ankles and being able to take care of that at home.
And you want to have that information at your fingertips. And going through a book is no longer what patients want. They want that, I got to click right now on the video and watch something that tells me how do I manage that. And they don't want to have to wait for the answer. It's an instantaneous, I need the health information now when it's most important to me.
Well, thank you both. I look forward to spraining my ankle here in the future.
Thank you. We hope not.
I appreciate it.